Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are with Dr. Hannah Evans, who is a rural GP. She works in Scotland and lives in Wales. She just returned from a trip to the Antarctic. Hannah, welcome to the program.
Hello, it's great to be here. It's really good to talk to you about some of the experiences I've had, and I'm a big fan of these podcasts. So, it's great to be here.
So, tell us a bit about yourself and what's keeping you busy.
Yeah, sure. So, currently I work as an advisor to the ambulance service in Scotland. So that covers the whole of Scotland, and essentially it's a little bit of telemedicine, and a little bit of me speaking to paramedics about cases and giving them some guidance and advice. So that's what I'm doing at the moment. I'm also a senior clinical lecturer for the undergraduate medical education at the University of Aberdeen. So in that role, I've been marking exams, giving lectures, and doing a lot of elective stuff. So I'm covering the elective module for the fifth years at the university. So that's what's been keeping me busy at work over the last wee while. I've also been to Antarctica, as you were saying. So that was back in February of last year, and that's an ongoing project that I've been working on. So that's pretty exciting, and that's the thing that I've hopefully going to come and going to talk about at the conference next week. I'm really excited about that. Sharing what we've learned and how that might be applicable to other people's practice is what it's all about.
Before we deep dive into your Antarctic deployment, you are a pre-hospital doctor. Can you explain that for the people listening where there isn't a physician pre-hospital option?
Sure. So I've done quite a lot of qualified as a GP. Before that, I'd done some anesthesia and some emergency medicine, ICM medicine in hospital settings. So taking those skills and as well as a GP qualification, and applied them in the pre-hospital setting. So that generally involves working as a GP in remote locations, which I've done quite a lot of during my career, and putting those skills that I'd learned before, and I've tried to keep up to good use in more remote settings around the world. So that's been a really exciting part of my career so far, is being able to function as a remote medic on a ship, or a remote medic in the desert, or wherever I get put. Just being able to use those transferable skills and try and improve healthcare in whatever way that might be.
So how does that work as a pre-hospital doc? So I'm in Scotland. I'll dial 999. How do I get you, or do I get a paramedic, or do I get both, or how do you decide as a doctor to which calls you go to?
Yeah, so it's not necessarily up to me. My role in the ambulance service is purely a remote role at the moment. So I essentially triage calls based on the history, and that might involve a video conference with the patient, depending, if it's a child, for example, that's unwell, it's a lot easier to decide whether a child is really unwell or not over video. If they're bouncing around the room and chatting back to you, then you've got a reasonably well child. Whereas if they're very lethargic and things like that, you can see that on the video. So we use a lot of that to help triage cases. Cases are triaged based on where they are, and obviously we have quite significant pressures at the moment on the ambulance service in Scotland. So it really does depend on how quickly we can get ambulances away from hospitals to where they drop the patients off, so that we're not in a situation where ambulances are waiting for hours and hours outside of a hospital with a patient waiting to offload them. So that's my role at the moment within the ambulance service, is to try and fend off, if you like, calls that could be better dealt with by another service. So whether that be an out-of-hours GP or an AMP or accident emergency, whatever route we think is best, we'll apply that. And of course, a lot of patients are told that it's not very easy and very safe to transfer themselves, whereas that's sort of my call, is to make that judgment as to whether somebody can take themselves up to hospital by themselves without any ambulance sort of monitoring or intervention. So that's another thing that's a part of that role.
So you're there to direct traffic as well as to treat patients.
Exactly. Yeah. And actually works quite well in removal of about 65% of the calls that we receive. So it does work quite well, having doctors on the ground to make the more sort of senior decisions about things, and obviously to, if there is somewhere better that a patient can get seen, to try and arrange that and get that in place for the patient. The patient's already waited on the phone for, however long, to call the number and to get through. So it's important for us to be able to direct them quite as sort of efficiently as we can to the place that they could best get care.
You work in austere environments, not just in Scotland and Wales, of course, but you're doing work as a site doctor in very remote locations. You mentioned the desert. We're going to talk about the Antarctic as well. Where have you worked as a remote doctor?
Yeah, so I've been very, very lucky during my career, and I've had a chance to work in some austere environments both in Scotland, the islands, and the west coast, the rural west coast of Scotland, where you're the only doc on, and you're on 24/7 over the course of a weekend or during the week. I've been lucky enough to be so in 2010 when I started my anaesthetics training. I started to do a lot of expedition cover, and so I have started off with some some Kilimanjaro Inca Trail, and then some events in Scotland as well. Went on to be medical lead for badminton at the Commonwealth Games in Glasgow in 2014. And did quite a lot of events, including sort of Land's End to John O'Groats cycles cover, and some rugby cover in Scotland. And then I've been to Jordan to do the Petra Trek. I've been to Greece to work as a humanitarian doctor, in Lesbos, and I've been to Bangladesh to work with victims of the Rohingya crisis. So that was really harrowing medicine, but really worthwhile, giving basic healthcare to people that so need it. That's kind of one of the reasons that I apparently did this job in the first place. So yeah, that was really good. I've covered quite a lot of sporting events over the course of the time, mainly cycling events throughout Europe as well. And then, of course, there's the Antarctica trip, which was amazing last year. So a friend and I got together, and he's a paramedic in Norway, and we got together to go to Antarctica and test this essentially what's a Peli case that he has, in partnership with Starlink. He has made this Peli case with a Starlink satellite in it, and we wanted to see whether we could use that for telemedicine in Antarctica, having had the lowest density of Starlink satellites in the world. So we wanted to see whether we could get this thing set up and running on a mobile platform, so i.e. a ship that was sailing to Antarctica at the time, going below the Arctic Circle. So we wanted to be as remote as possible to test this thing out. So that's what the trip in February was all about.
And what did you find out? Were you able to do telemedicine in the Antarctic?
Yeah, so we were able to use this box to do telemedicine in Antarctic. We were able to send ultrasound videos. We were able to send ECGs in live, essentially live stream, a monitor with ICM level data, and using the arc light to send photos of eardrums and things like that. So yeah, we were able to use all of that and the butterfly to use to get some nice images to send to doctors and paramedics all around the world. And we set up calls with them to review the material and see how well they'd got on with the technology aspect of the challenge, if you like. So yeah, that was really interesting.
Is that the most remote job you've ever had?
Yeah, it felt really remote. I think south of the Antarctic Circle is pretty remote. It felt like we were on a proper expedition, so that was good. It was very there was some great wildlife and fantastic scenery to take in along the way. So we were sat on the back of this boat trying to get this module working with all the different monitoring that we had available to us, and trying to sync up and tidy up as best we could the website for people wanting to log in and see the information. But yeah, it was in a pretty fantastic setting. So I'm very, very lucky to have got the opportunity to go. But yeah, it was fantastic that we got the results that we wanted as well. You go on these things not really knowing if you're going to sit there being very frustrated at a box for 2 weeks, rather than actually achieving anything. So yeah, it was lucky that we managed to get things working together and get some feedback from some medics around the world.
Nice. Did you get feet on the ground as well? Did you actually get to the South Pole?
Yeah. So got feet in penguin poop, so I think that counts. Yeah. So we got we took the box on shore with us as well. We went on the Zodiac boats to the shore, and we managed to get some live streaming of a patient, and I'll be able to show you that next week. Some live streaming of a patient wearing our monitor, which is being sort of live streamed. So telemedicine in a really rural, remote environment, and showing you some penguins as well, obviously, just to complete the picture. But yeah, the important thing was showing that we could use this in Antarctica itself, as well as on the back of a boat that was a few meters offshore. So,
and you're speaking at our conference in Malta at the end of the month. This is this topic you're going to give us?
Yeah, so I'm going to talk about the difficulties we had during the expedition, and some of the things that went well, and some of the applications of this for future projects. And I think this would be great in humanitarian environments where the infrastructure's down, and so yeah, there's lots of applications for it, and there's lots of improvements still to make. So I think yeah, we were just trying to prove that this is a pretty rugged, easy to transport, reasonably low cost solution to having telemedicine as a barrier, almost, to getting good medical advice for patients.
That's fantastic research, and it's definitely needed to be able to have telemedicine anywhere on the planet.
Yeah. The only slightly difficult thing at the moment is the how many satellites there are in the sky, which is growing day on day. But yeah, that was the only sort of difficult part we had. Some issues with, but overall it was a great finding, and seems to be quite well received by medics around the world. So we were getting the time zones all lined up and things like that, so that we could speak freely with medics around the world. So yeah, we just had some great volunteers from lots of different places. So yeah, so that was really, really helpful.
I'm looking forward to hearing this, and you've spoken at our Medicine and Mediterranean conference last year, and you're again here this year. And but you've been down to Pretty Bay before. You've been down to teach for us. What was that like, or what were you teaching?
I have, yeah. I think I was teaching TTEMS, but yeah, I think that was a little while ago. But yeah, I was at the conference last year in Malta, and it just brought together some great people. I met some really, really fantastic medics from around the world, to be honest. Yeah, and it was a great opportunity for me to listen to some up to date stuff from the field as well, because that was really important to get those CPD points in, as well as learning some really important things. So I'm really excited about coming down to listen to the talks that you've got on, because it sounds like a great conference.
We have 3 times the amount of attendees that we did last year, and a lot of them are coming for the CPD. So we have FOM credits, the fellowship credits, we have EU doctor credits, but the FOM seems to be a big pull, and you've earned your FOM. So tell us, what is, for those that don't know about the Fellowship of the Academy of Wilderness Medicine, what is the FOM, and how was that process for you?
Yeah, so I did mine in, I think, 2014 or something like that. Quite a wee while ago now. But essentially, it was, at the time there weren't that many FOM affiliated organisations or opportunities to learn, other than to go to America and to attend some courses and things over there, which was prohibitive for the UK medic cost wise. So I'm really excited that more and more organisations are getting FOAM credited for their education. I think that's a really exciting thing. So the FOAM is the Fellowship of the Academy of Wilderness Medicine. It's a portfolio-based award, which involves you picking up points in various domains to show that you're a competent wilderness medic, and putting that all into a form onto a computer, and then you make sure that you've got enough points in all of the domains, and then you submit your evidence, and then they decide whether you get the form or not. So that was back in 2014, so it's a little while ago, but it seems to be definitely growing in popularity, and the respect that you have for people with that qualification is quite something. It's after doing it yourself, you know how much work and how difficult it can be to achieve. So yeah, I'm excited about that.
Yeah, the fellowship, the FOM, is a really good option for docs, medics, and nurses. And I've been a firm believer of this for 15 years, and was one of the first providers of FOM credits back in 2012 through Remote Medicine Ireland, before we moved down to Malta. And then Quorum is the largest provider of FOM credits outside of the USA. So we're spearheading this, we're pushing this, because we believe in this. Like, the FOM is a fantastic option for the remote medic.
Yeah, I certainly agree. I think it's a really good, a good all-rounder sort of certificate to have, definitely.
So you have also recently earned your fellowship with the Faculty of Remote, Rural, and Humanitarian Healthcare. Congratulations on that. But tell us, what is the FFRRHH?
Thank you very much. Yeah, it's something I'm very, very proud of. It's it's again a portfolio and reference-based award that's awarded by the Royal College of Surgeons of Edinburgh to those with specific skills in an area of remote medicine, or humanitarian medicine, should I say, as well. And you essentially submit a portfolio of evidence, and a CV, and some references from some colleagues, and that they again decide if you're a fellow or a member at that stage, depending on your sort of managerial management side of things, your experience of those sorts of things. So yeah, I'm very, very humbled to receive that award. I think it's as you know yourself, it's something that makes you sort of reflect back on things and grow a little bit from.
Well, you have definitely earned it. Like, you have done so much for Austere medicine, and I'm an assessor for the fellowship applications through Edinburgh. And when your name came up, I had to rescind myself since I knew you. But I've seen your application, and I knew that you would be an easy one to vote on. And we do have to do voting for each fellow application that comes in. But Hannah, you've been on the spearhead of austere medicine and pushing for this for a very long time. You definitely have deserved both of these fellowships.
Thank you, and that means a lot coming from yourself. I think, you know, this area of medicine is evolving, and it's something that there are small groups of people that are pushing for, and COROM is definitely one of those, without a doubt. And you know, but it's still an area of medicine that's up and coming, if you like, and people are getting more and more excited about it and more involved in it. We've got medical student wilderness medicine society at medical school now, and that's great because from there was nothing like that when I was at university. So it's just showing progress in this very sort of acute but different area of medicine that people can go into and enjoy. So yeah, I'm excited about the future of wilderness medicine around the world. There's several enthusiasts coming to the fore.
So you teach on the medical school in Aberdeen. Do you bring in some wilderness medicine for those medical students?
Yeah, definitely, for sure. I enjoy. So we've got special study modules, and I am I facilitate those sessions, and basically the medical school ask for a subject matter. So I might write something like remote medicine or expedition medicine or something like that, and then the students come up with ideas of what kind of project they want to do, and they have about a month to do it, with no other commitments in their diaries. So they get a month to produce a piece of work to reflect. So we've managed to do two student projects involving sort of hyperbaric medicine, which was one of them because I'm quite interested in diving, and the use of tranexamic acid in trauma. That was the other one we did. So yeah, I do try and incorporate that into it, and especially for those students, because the unique thing about Aberdeen is that they take the students, really rural. So Shetland, Orkney, the Western Isles, the islands over the west coast of Scotland. They'll take the students there, and so I feel that they do need some wilderness skill to be able to go to these places and be helpful, and learn the maximal that they can. So I do feel that I do bring some of that stuff that I've learned into the forefront of the way that I teach, because I just sort of think that if we weren't in this comfortable hospital, and we were somewhere completely rural, remote, distant from anywhere, how would the way that we practice medicine change, and how can we make it as good as the care that we give in the hospital? And that's really important to me, is keeping them on track that way.
Nice. Do you give them like the Advanced Wilderness Life Support certification?
So no, they don't do that at the moment. That's a really good thought. Yeah, because that would be a lot of them do it if they're in the Wilderness Medicine Society. They'll do it those kinds of sessions in their training nights that they have. But if they're not, then they don't get that sort of official training. They get BLS, and I think they get a critical illness sort of course. But yeah, they don't get any specific outdoor training unless it's within the group that they have.
Dr. Hannah Evans, my final question for you is this. What advice do you have for the new doctor, the new nurse, the new paramedic who is just starting out in their career in austere medicine?
That's a really good question. So I guess the main thing that I'd say is get out there and do the things that you are interested in, and or do the courses that will help you be able to do the things that you're interested in, and really persevere, because I've had quite a lot of no's in my career. That's fine. We move on, and we make things. We try to do things that can lead to progress. And I'm very enthusiastic about that in itself. I think showing enthusiasm, and showing that you want to learn, going to conferences, going to places where you can connect with people that have similar interests, are definitely the way forward. And looking at social media and really following individuals that have got a lot of experience in the area that you're interested in, and following them and seeing what they're up to, and seeing if anything can align in terms of a project together or something like that. So yeah, I think that'd be the main advice that I'd give people, is to really be diligent and follow this career, because it's a really exciting career and it's really, really rewarding. And you can apply medicine to whichever domain you like. So yeah, to keep up your skills, and to keep up communicating with people about this area of medicine and interesting things that you find, because that's how we all learn.
That's good advice. And Hannah, I'm grateful for you to be on our podcast today. I am looking forward to seeing you again in Malta and on the conference, and to hear your presentation on what you've done in Antarctic medicine. And I look forward to seeing your next adventure as well, to see where in the world you're going and you're pushing austere medicine forward.
Thank you very much. That's really, it's really great to be here, and I'm really humbled that you've invited me. Thank you.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.